This is a 44-year-old female that fell 5 months prior to seeing me. 1 month after the fall is when she started noticing some pain in the vicinity of this osteochondroma that's radiating distally towards the ankle. Here is an anatomic model of this patient's lower extremity where she has an osteochondroma of the proximal medial tibia. There is a cartilaginous cap on top, which you can see here as well. And here we're just rotating, and you can appreciate that there is a little fluid collection inferior to this osteochondroma, which I believe is irritation perhaps from the osteochondroma rubbing on the medial gastrocnemius muscle, causing some bursitis or perhaps even a small hematoma in that region. This is where she was tender, so we decided to do a ultrasound-guided cortisone injection, which you can see here. The needle is going from a proximal to distal direction. The probe is orientated long axis to the needle. Here the fluid collection is somewhat translucent and we're injecting the cortisone. And here again is that fluid collection without that translucency. So here in axial view you can appreciate this osteochondroma with this cartilaginous rim. And now we're basically prepping for the procedure. We're in an anterior sagittal perspective with the probe, and we're going to be basically seeing the needle in long axis going from proximal to distal. And here you can see the needle moving some tissue just above this osteochondroma, and you can appreciate the needle heading right towards this fluid collection. And the needle is essentially skimming right above the osteochondroma, and I believe this is an adventitious type bursitis caused by irritation of the osteochondroma, perhaps against the medial gastrocnemius muscle. And here's the needle within this fluid collection, and we're injecting cortisone. She is 2 months status post injection, osteochondroma that probably irritated her. And how are you feeling right now?
I feel good.
Did the pain come back at all?
No.
No. Okay, great, great.